Hello, good evening everyone. Myself, Dr. Akash Setwala, General Surgery Resident from KIMS Bhuj. So today we will talk about the plain catgut and chromic catgut. What are the difference between them? What are the use and how to identify? So catgut, general overview. Catgut are natural absorbable sutures. They derive from purified collagen of sheep and bovine intestine. Absorption by proteolytic enzymatic digestion. Variable absorption depending on tissue environment. Now plain catgut. Untreated natural catgut. Rapidly absorbable. Monofilament structure. Higher tissue reactivity. These all are the identity of plain catgut. Now, what is the tensile strength of plain catgut? It has rapid loss of strength. It has significant reduction within 5 to 7 days. Minimal support after 10 days. Now, what is the plain catgut absorption profile? Its absorption via proteolysis, complete absorption in 60 to 70 days. It is highly variable in infected or inflamed tissue. Now, plain catgut handling properties. It has good pliability, easy knot tying, moderate tissue drag, and not security acceptable. Now, plain catgut tissue reaction. Moderate to high inflammatory response, more reaction versus synthetic sutures, and it can accelerate absorption. Plain catgut indications. Rapidly healing tissues, mucosal closure, subcutaneous tissue for limited use, as well as use as a ligature for minor vessels. Now, it has also unpredictable absorption, increased tissue reaction, not ideal in infected wounds, and it has weak long-term support. Now, chromic catgut. After knowing about the plain catgut, now we should learn about the chromic catgut. So what is the identity for chromic catgut? It has catgut treated with chromium salts, delayed absorption and reduced tissue reactivity versus plain. This is the chromic catgut identity. Treated with chromium salt, delayed absorption, reduced tissue reactivity versus plain catgut. This is the identity for chromic catgut. What is the tensile strength of chromic catgut? It has slower strength loss, retains strength for 10 to 14 days, better prolonged support. This is the chromic catgut tensile strength. Now, what is the absorption profile? It has proteolytic absorption, complete absorption within 90 days. It's more predictable than plain catgut. It is more predictable than the normal plain catgut suture. So, as we know, it will be absorbed by proteolytic. It is having complete absorption within 90 days and it has more predictable than plain catgut. This is the absorption profile for chromic catgut. Now, what is the handling properties for chromic catgut? It has slightly stiffer than plain catgut. It has very good knot security. it's having acceptable handling. These are the handling properties for chromic catgut. So, stiffer than plain catgut, good knot security, and acceptable handling. These all are the properties for chromic catgut. Now, tissue reaction for chromic catgut. Tissue reactions like less inflammatory response. Chromium salts reduce enzymatic attack. Better tissue tolerance. These are the tissue reaction for chromic catgut. Now, what are the indications for chromic catgut? So, indications to use chromic catguts were tissue needing longer support. In any tissue which need longer support, we should use chromic catgut over the plain catgut. For muscle or fascia, for low tension closure, we have to use chromic catgut for muscle or fascia. For low tension, it is useful in gynecological surgery, and it's also useful as a ligature to ligate the minor vessels. These are the indications to use chromic catgut. Now, after knowing the indication, we should also know about what will be the limitation to use chromic catgut and what are the limitations for stitch material. So, it has more reactive versus synthetic sutures as it's natural, so it has more tissue reaction with body over the synthetic sutures. Its absorption variability persists. It depends on patient factor as it has more absorption variability. Not ideal for high tension closure. Chromic catgut has its own limitation. It's not ideal for high tension closure. Chromic catgut is more reactive versus synthetic sutures, and absorption variability persists. Not ideal for high tension closure. Now, plain versus chromic catgut key difference. Treatment will be like difference are chromic catguts are treated with the chromium salt, but against it plain catguts are natural. No treatment is given to the stitches. Strength retention. Plain catgut has rapid strength deterioration versus chromic catgut has delayed strength retention. Tissue reaction is higher in plain catgut and it has very lower tissue reaction for chromic catgut. These are the plain versus chromic catgut differences. Chromium salt, rapid versus delayed, higher versus lower tissue reactions. Now, what are the strength? We have to comparison or strength. So, plain catgut has strength lost within 7 days, and against it chromic catgut has strength retained to 10 to 14 days. So as we know, plain versus chromic catgut strength comparison, plain catgut has strength lost within 7 days, and against it, chromic catgut has strength retained 10 to 14 days. Absorption time. Plain catgut has 60 to 70 days, against which it's having shorter duration for absorption. But chromic catgut has longer duration. It has around 90 days to completely absorb. So it will give more strength to the tissue till 90 days. Clinical decision making. If we need rapid healing, we should use plain catgut as it's having lowest absorption time of 60 to 70 days. And if we need longer support, we should use chromic catgut as it has longer duration for absorption, around 90 days. So it will give longer duration of support. Now we should also consider any infection or what are the tissue type to use which type of suture we should use. This is the clinical decision making. For any stitch, when to use, what's your indication. Now, catgut versus synthetic absorbables. So, catgut will be absorbed by enzymatic absorption, but against it, synthetic sutures were absorbed by hydrolysis. It's predictable. So, for synthetic, it's absorbed by hydrolysis, so they have very less tissue reaction. But due to enzymatic absorption, they have tissue reactions are high for catgut. Now, modern surgical practice, declining use of catgut. So, they were replaced by Vicryl, monocryl, PDS, but still they are used selectively in surgeries. Plain catgut are rapid absorption, high reaction. Chromic catgut are chromium treated, delayed absorption. Both mechanisms are proteolysis. Catgut absorbed by hydrolysis is the wrong statement. They are by enzymatic, ignoring variability in infection and never confuse between absorption duration. So both are natural absorbable sutures, rapid strength loss for plain catgut, delayed absorption and longer support for chromic catgut, synthetic absorbables preferred today. Thank you.